so many requests from my YouTube channel and Facebook accounts. The people are asking and calling me to tell something regarding the rheumatoid arthritis. Today, me and Dr. Gupta will discuss what is rheumatoid arthritis and how we as a homeopath can help the people to cure and to become fine in rheumatoid arthritis.
Rheumatoid arthritis.
First of all, what is the rheumatoid arthritis?
Yeah.
It's an autoimmune disease. You know. Can you tell something regarding autoimmune disease? And there are some diseases you can.
Definitely. Autoimmune disease is a specific sort of disease where our immunity cannot recognize the foreign bodies. In these cases, what happens? The immune system attacks the own parts of the body. There are several types of autoimmune disease such as SLE, rheumatoid arthritis, psoriasis, many more. And today we will discuss about rheumatoid arthritis.
There is I should say, there is one very good definition regarding the rheumatoid arthritis. I must read out what is the definition of the rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory, destructive, deforming polyarthritis. Chronic, destructive, deforming polyarthritis with systemic disorder.
Definitely.
It's a dangerous thing. The definition is itself tell what is the rheumatoid arthritis. How we feel the rheumatoid arthritis. The one patient, how will feel? Practically, first of all, it's an etiology from where the rheumatoid arthritis is coming, it is unknown.
Yeah.
We cannot tell definitely what is the thing that rheumatoid arthritis came. Etiology is unknown. Generally it may come from the hereditary, it may come in other ways, but etiology is unknown. How we feel, generally, first of all, it is remain asymptomatic. Near about at the age of 30 and onwards, we are seeing the symptoms are coming. What? The pain in the small joints, first of all. Inflammation and pain comes in the small joints. Then we neglect the pain. Because we have a pain in the small joint. Sometimes we neglect, sometimes the patient neglects. That is coming from the symptoms of the rheumatoid arthritis in the very beginning. Gradually, it may come to the male and female also. Gradually, rheumatoid arthritis coming in the bones, in the big bones, in the shoulder joint, in the wrist joint, in the knee joint. They are coming in the pain. And pain is become very severe. Very severe. The patient, yesterday one patient gave me the video on my WhatsApp. The one female, age 45 years, all bones are deformity. He treated in the several ways. And she is helpless and asked me, what can I do? I told him, I suggest him to come to my chamber and I will give you the detailed case taking. I will try to help her. So pain is coming in the different parts of the body. That is among them, it's gradually the deformities is coming. And in the systematically, it may change in the cardiovascular disease also. Yeah. In the case of cardiomyopathy may come, and different types of symptoms are coming. Now, how this is the symptoms are coming, and pathologically, what test we have to done. In case of rheumatoid arthritis, ESR will be high, IgM will be present in there, and C-active protein will be present in there. These are the main features are coming in the rheumatoid arthritis. Can you tell me, Dr. Gupta, then what type of treatment we are getting? The one patient is getting what type of treatment, what system of treatment is there to help the rheumatoid arthritis? In case of allopathic or in case of homeopathy, can you suggest something?
In case of rheumatoid arthritis, when we are going to discuss about the treatment, we generally find three modes of treatment. One, allopathic; number two, homeopathic; number three, Ayurvedic.
Yeah.
Ayurvedic treatment, they do along their principles. In case of allopathy, they usually give NSAID, non-steroidal anti-inflammatory drug, number one. Number two, DMARD and the steroids. And in most of the cases, when the physicians give these type of drugs to the patient, initially it will reduce the pain, it may reduce the inflammation of the joints in case of rheumatoid arthritis, but they are not able to cure the disease. Autoimmune disease is a type of disease which is actually incurable. We have to maintain the symptoms of the patient, and we have to help the patient in order to get relief from the pain, and we have to restrict the inflammation of the joints which may form deformities in later. In case of allopathy, they do prescribe their medicines, and after a course of 1 week, 2 weeks, 2 months, 3 months, they usually do the investigations, blood investigations such as creatinine, LFT, in order to see whether the allopathic medicine is creating any side effect for the patient. But when we come to our pathy, in case of homeopathy, the contraindication of the medicine is not present in case of homeopathic medicine. There is no side effect for homeopathic medicine. We will take the total symptoms of the patient, and then we will prescribe our medicine, which will first restrict the deformities of the joints. The patient will come to our chamber repeatedly, and they will give their symptoms. On the basis of the improvement or the aggravation, the doctor will change the medicine. There are several medicines in case of rheumatoid arthritis. You can tell about that.
We are going to the medicine. Before that, one thing, as I am working also as a nutrition part, I must say something regarding the nutrition part. How we can prevent autoimmune diseases? It cannot be. It's a basically Dr. Gupta says is an incurable disease.
Yeah.
But we can prevent the disease if we maintain our nutritional balance in our body.
Yeah.
The immune system, whether immune system is attacked, if from the very beginning, if we maintain our food balance, nutritional food balance in our food, then we can prevent the autoimmune. We can prevent to attack our immune system.
Definitely.
If in that case, first of all, I must say, everybody should do regular exercise.
Yeah, that is very important.
Regular exercise.
Yeah.
Not that I have a rheumatoid arthritis, I started the exercise. Not that. For anything, you have to do regular exercise, at least 15 to 20 minutes regularly.
Here I will like to mention you that along with the exercise, patient may also consult the physiotherapist.
That is, I am not telling about the after the disease, and not to prevent, not to disease.
Okay.
One person should take 1 gram of protein as per his body weight. If you have a 60 kg body weight, you have to take 60 grams of protein daily. And vitamins and minerals, especially vitamin C and other minerals, if you take from your foods, and you may consult with the nutritionist, there is no scope here to tell all the things, you may prevent all the diseases from the very beginning. In case of homeopathy, we treat the patient, not the disease. There is no medicine in homeopathy calling rheumatoid arthritis. No medicine. But as we treat the patient, if the symptoms corresponds, in case of anything, in case of rheumatoid arthritis also, it creates a magic. We have treated, and in that case, we need to proper detailed case taking. Then only homeopathic medicine is coming.
Definitely.
We will discuss 2-3 medicine, but you don't take this medicine without consulting any qualified doctor. It doesn't mean those medicine we will going to discuss in small form. It is not all. Definitely don't take those medicine. You must consult in your locality with a qualified, educated homeopath. First of all, the common medicine that is called pulsatilla.
Yeah.
In case of pulsatilla, what you will get, the patient is mild in character. Pulsatilla pain in rheumatoid arthritis is shifting type of pain.
Wandering type of pain.
Wandering type of pain.
Yeah. It moves from one part to
One part to
parts of
other
the
part.
body.
And pulsatilla patient thirstless and she is chilly.
Definitely.
And there are you can take have some symptoms regarding the meadow. Medorinum is a very good medicine. Syphilinum is a very good medicine.
Medorinum, syphilinum, carcinosin. These are the medicine actually comes from the family history and the past history of the patient. We have to we have to take the case of the patient totally. It will give the totality of the symptoms, and on the basis of that we can select medorinum, carcinosin and syphilinum. And there are other medicines also like arnica, lidampal, belladonna. These are medicines which you can give on the basis of the presenting symptoms. Suppose a patient having an acute exacerbation of the chronic disease. Suppose a patient is getting a severe pain in case of a rheumatoid arthritis. A patient having rheumatoid arthritis for 5 or 6 years suddenly got a severe pain or inflammation of the joints. There is redness in the joints. In that case, you can call for belladonna. In sometimes the patient has severe pain when it aggravates on the first movement. In that case, you can go for Rustox. And in case of Rustox, in the previous video we have discussed that one application will ameliorate the pain of Rustox. That is very important. Arnica, there is a bluish type of pain. This is very important. And there are many medicines, but it is always advisable for the patient to consult their local homeopathic doctor so that he can take the case and prescribe the medicine successfully.
On the basis of the main homeopathic law, similia similibus curantur. And the single medicine prescription is the best for the chronic treatment. And that's for today. Hope it will help you. Thank you.
Thank you.
Thank you so much.